The first few weeks for me was really hectic. We were really on call 24/7.
To test all the residents, among them
called spike proteins.
Penularan baru wabak ini yang dibimbangi akan menyakiti lebih ramai rakyat.
However, in a subset of patients, the virus attacks the lungs, causing a much more serious infection. Small air sacs in the lungs add oxygen to your blood cells. This oxygen is then transported to organs and tissues throughout the body. When the coronavirus attaches to a cell, it begins to replicate within the cell. The body's immune system attempts to destroy the virus, which results in an inflammatory response that causes fluid accumulation in the lungs. As the lungs fill with fluid, the body's available oxygen decreases, which can lead to organ injury and death.
Day-to-day symptoms of COVID-19. Before proceeding, please note that this general overview is compiled for initial self-assessment only and may vary for each individual. If you're not feeling well, you should immediately consult a medical practitioner to have an accurate diagnosis and proper treatment of COVID-19. The typical daily symptoms are concluded from the study of 138 patients at Zhongyang Hospital of Wuhan University, and another study involving 135 patients from Jinyintan Hospital and 56 patients from Wuhan Pulmonary Hospital. These symptoms are broken down into Day 1 to Day 2. The beginning symptoms are similar to the common cold, with a mild sore throat and neither having a fever nor feeling tired. Patients can still consume food and drink as usual. Day 3. The patient's throat starts to feel a bit painful. Body temperature reads at around 36.5 degrees Celsius. Although it's uncommon, other symptoms like mild nausea, vomiting or mild diarrhea are possible to set in. Day 4. Throat pain becomes more serious. Other symptoms like feeling weak and joint pain start to manifest. The patient may show a temperature reading between 36.5 degrees to 37 degrees Celsius. Day 5 to 6. Mild fever starts. The patient show a temperature reading above 37.2 degrees Celsius. The second most common symptom, dry cough, also appears. Dyspnea or breathing difficulty may occur occasionally. Most patients in this stage are easily feeling tired. Other symptoms remain about the same. These 4 symptoms are among the top 5 key indications of COVID-19.
The virus causing this disease is known as Severe Acute Respiratory Syndrome Coronavirus 2. The disease spreads through small droplets that are expelled from the nose or mouth when a person with COVID-19 coughs or exhales. Therefore, standing close to someone who is infected can put you at risk. These droplets can land on your hand and be transmitted through something as simple as a handshake. If afterwards you touch your eyes, nose, or mouth, the so-called T-zone. The virus is known to survive on different types of surfaces, so touching these contaminated surfaces and then touching your T-zone brings a high risk of infection.
Pneumococcal pneumonia is an inflammatory lung infection associated with symptoms of pneumonia, including fever, cough, and difficulty breathing. During normal respiration, air travels through the lungs to the alveolar or air sacs. Pneumococcal pneumonia is the result of the alveolar sacs filling with fluid, obstructing normal airflow, most commonly caused by Streptococcus pneumoniae, also known as pneumococcus.
One of the important jobs of the kidneys is to clean the blood. As blood moves through the body, it picks up extra fluid chemicals, and waste. The kidneys separate this material from the blood. It's carried out of the body in urine. If the kidneys are unable to do this, and the condition is untreated, serious health problems result, with eventual loss of life.
If you suspect you have coronavirus, call your local hospital or doctor's office and explain your situation. They will direct you on the best course of action to take. Some preventative measures you can take are: stay home if you are sick, avoid large crowds or densely populated areas, cover your coughs and sneezes. Remember, it is best to cough or sneeze into the inner side of your elbow to avoid getting germs on your hands. Avoid touching your eyes, mouth, and nose. Disinfect commonly used surfaces around the home and office to help curb the spread of the virus. The CDC recommends cleaning your phone at least once per day. Wash your hands frequently with soap for at least 20 seconds, and use hand sanitizer between washes or when you're on the go. With the tips in this video, you can help protect yourself and prevent the spread of the coronavirus and other respiratory viruses.